Okay, imagine, right, you're trying to build something really complicated, like maybe some flat pack furniture, but the instructions are in a language you totally don't know.
Yeah, you'd be completely stuck.
Exactly. And well, understanding the human body, it's
Yeah,
kind of like that. You really need the right language, the right vocabulary, just to even start describing what's where and what's happening.
that's a great analogy. And what's really cool here, I think, is that this language isn't just made up on the fly. It's this highly standardized system. It's universal, really.
Hmm.
Allows anyone who knows it to talk about locations, structures
Yeah.
with incredible precision. It's the map, the foundation.
And that map, that language, that's exactly what we're digging into today. We've got these sources here, a set of slides called Anatomical Terms and Regions.
Right.
And our mission for you listening is that by the end of this, you'll be able to, identify some of these basic terms, these regions, but maybe more importantly, kind of grasp why we use them, how they actually form the bedrock for understanding, well, pretty much everything else about the body.
Yeah, think of it like getting the master key. It unlocks so much. A doctor explaining something, a PT giving you exercises, even a coach talking about an injury.
Uh-huh.
Without this shared vocabulary, it's all just guesswork, really.
So this is like getting your bearings, finding north on the map before you even step foot into this amazing, complex landscape that is the human body.
Perfectly put.
Okay, so let's unpack this. Before we can even say where something is like, is it above, below, left, right of something else?
Mhm.
We need like a fixed starting point, don't we? Every map needs that north.
Exactly. And in anatomy, that standard reference point is called the anatomic position. And what's really crucial and interesting is how simple it seems, yet how vital it is. It gives us that consistent starting point. Doesn't matter if the person is lying down, sitting, whatever.
Okay, so what is this position? The slides mention it. Slide 3, I think.
Yep, slide 3 lays it out. It's standing up straight,
Okay.
facing forward,
Yeah.
arms down at your sides.
Right.
And here's the slightly weird bit, maybe palms facing forward.
Yeah. Standing tall, looking ahead, arms down, palms forward. Okay. It seems simple, almost like too simple. Why that specific way? Especially the palms forward, that feels a bit unnatural.
That's a really important question, actually.
Yeah.
Why palms forward? It does feel a bit strange, but it standardizes everything, not just front and back, anterior and posterior. It locks in medial towards the middle and lateral away from the middle.
Ah, okay.
And crucially, think about describing arm movements like twisting your forearm, supination, pronation. If your palms weren't facing forward as the default, describing those movements gets really ambiguous really fast.
Oh, I see. So it's not just about front back. It locks in the references for sideways and rotational stuff too.
Exactly. It just eliminates potential confusion across the board for all anatomical descriptions. It's the non-negotiable starting line.
Okay, that makes a lot more sense now why it's so specific.
Yeah.
So we have our standard position. Now what? You mentioned slicing things up.
Metaphorically speaking, yes. Now we can talk about these imaginary lines or planes that slice through the body. This helps us create sections for description.
Right, body planes. I think I've heard about these, maybe with MRI scans or something, like different views.
Yes, exactly like that. Slide 4 describes these imaginary flat surfaces that pass through the body. And the key thing, they're always oriented relative to the body being in that anatomic position we just talked about. Even if the scan is done lying down, the description uses planes as if you were standing in that position.
Okay, constant reference. So what kinds of slices or planes are we talking about? Why these specific ones?
Well, slide 5 covers the 3 major ones. First up is the sagittal plane. Think of a vertical slice right down the body, dividing it into left and right portions.
Straight down the middle, front to back.
Yeah, if it's exactly down the middle, that's the mid-sagittal plane. Any vertical slice parallel to that, but off-center, is just called a parasagittal plane. So separating left from right.
Got it. Left side, right side. What's next?
Next is the frontal plane, sometimes called the coronal plane. This one's also vertical, but it runs side to side. It divides the body into a front part and a back part.
Okay, so anterior and posterior portions. Front half, back half.
You got it. And the third main one is the transverse plane. This one's horizontal. It cuts across the body, dividing it into an upper part and a lower part.
Like slicing a bagel or a loaf of bread horizontally. Superior and inferior sections.
Precisely, top and bottom. So you've got these 3 fundamental ways to divide things up.
Right.
Left, right, sagittal, front, back, frontal, coronal, and top, bottom, transverse.
Vertical cuts and a horizontal cut.
Yeah. And like you mentioned with imaging, understanding these is super practical. If a report says transverse view, you immediately know you're looking at a cross-section, like looking down from above or up from below.
Ah, okay.
A sagittal view means you're seeing it from the side, looking at structures from left or right. It just tells you the perspective instantly.
That makes it way more concrete. It's not just abstract geometry, it's literally how we look inside.
It really is.
Yeah.
Before we take a look at the meaning of specific anatomical terms, I suppose the first question we should answer is, why do we use anatomical terms? Well, anatomical terms exist so that we can precisely describe the location of features on a body. Let's imagine the following scenario. Here is a female. She's upset, and it's not just because she's naked on YouTube. It's mostly because she's just discovered a rather large pimple on her stomach. But where exactly on her stomach is it? Statements like "there's something on my stomach" are so vague and non-specific that they don't really mean anything to an anatomist. Is the pimple here, or here, or here? But if we use correct anatomical terminology, it's possible to precisely identify the location of her pimple or any other body feature so that anyone can precisely locate it. For example, if we're told that her pimple is 2 centimeters superior to her navel or belly button, then its location becomes obvious to everybody, which is probably not what this female wants. Before we move on from this picture, take a good look at how the woman's body is positioned in this drawing. Note how she's standing upright, arms at sides, palms facing forwards, and feet together. We call this the anatomical position, and it's the international standard position in which structures of the human body are described. Whenever you use anatomical terms, always apply them to a person standing in the anatomical position. Never apply them to, say, a person sitting on the ground or upside down or bent over sick after a heavy night out. Okay, let's look at some anatomical terms. The first terms that we're going to define are the terms left and right. Now, I know what some of you are thinking. Didn't we learn this in preschool? Well, even though you might think that the definitions of left and right are straightforward, many students actually use these terms incorrectly. You see, when we use the terms left and right, we're referring to the left and right sides of the person standing in the anatomical position, which in this case is the woman in this drawing. We are not referring to the left and right sides of the observer, which in this case would be you looking at this drawing. Consequently, for the woman in this picture, this is her left side and this is her right side. So if you are asked in a test to describe the position of, say, point A relative to the umbilicus or belly button, the correct answer would be point A is to the left of the umbilicus. Okay, next are the anatomical terms anterior and posterior. Anterior means front of the body, whilst posterior means back of the body. In humans, you can also use the term ventral for anterior and dorsal for posterior. Here are two examples of how you might use the terms anterior and posterior in a sentence. Example 1. The navel or belly button is on the anterior or ventral surface of the body. Example 2. The heel is posterior or dorsal to the toes. Next are the terms superior and inferior. Superior means above or towards the head. Inferior means below or towards the feet. For example, on this drawing, point A is superior to point B. However, point C is inferior to point B. Next are two anatomical terms that you probably haven't heard before. They are proximal and distal. These terms are only used to describe the location of 2 points on the same limb, which could be either an arm or a leg. Proximal means closer to where the arm or leg inserts into the body. Distal means further away from where the arm or leg inserts into the body. On this arm and leg, red arrows indicate proximal, whilst green arrows indicate distal. We can use the terms proximal and distal in the following ways. On the leg, the knee is proximal to the ankle because the knee is closer to where the leg inserts into the body. But on the arm, the wrist is distal to the elbow because the wrist is further away from where the arm inserts into the body. Remember, only use the terms proximal and distal when referring to 2 points on the same limb. If a point is no longer on a limb, like point A in this drawing, then you can't use the term proximal anymore. Instead, point A would be superior to point B. Next are the terms medial and lateral. Medial means any point closer to the midline of the body. The midline is an imaginary line that cuts the body in half vertically. Lateral means any point away from the midline. For example, in this drawing, point A on the leg is medial to point B because point A is closer to the midline. Alternatively, you could say that point B is lateral to point A because point B is further away from the midline. Another example would be your thumb being lateral to your little finger on your hand. Okay, now that you've mastered the basics, try to answer the following question. Using correct anatomical terminology, can you describe the position of the nose relative to the eyes? I'll give you 5 seconds to work it out. Hopefully you answered the nose is medial, inferior and anterior to the eyes. So far, all of the anatomical terms that we've described are what we call directional terms. That is, they're terms that describe the position of one external structure relative to another. But what happens if we want to observe the relative locations and arrangements of internal structures and organs, like for example the heart, lungs and brain? Well, to do this we need to cut the body into slices called sections or planes. The 4 anatomical planes are sagittal, frontal, transverse and oblique. A sagittal plane is a lengthwise or vertical cut that divides the body into left and right portions. If the cut passes through the midline of the body, then we call this a mid-sagittal plane. However, if the cut doesn't exactly pass through the midline, we call this a parasagittal plane. Next is the frontal plane. This plane divides a body into anterior and posterior portions. For example, a frontal section of the head would divide it into the face part and the back of the head part. Next we have the transverse plane. This is a horizontal cut that divides the body into superior and inferior portions. Finally, there is an oblique plane, which passes through the body at, you guessed it, an oblique angle. The importance of understanding planes becomes obvious when you look at these 3 drawings of the brain cut in sagittal, frontal and transverse section. Note how different each brain section appears, and how some features, like for example the pons, are easy to see in one section but difficult to observe in others. Thanks for watching. If you poke and prod at your abdomen, you might be tempted to think that your body is a solid mass of bone, muscle, organs, and tragically for some of us, fat. But it turns out that our bodies actually contain many important spaces, or cavities. Some of these cavities, like for example the nasal cavity, open to the outside of the body. However, most of our cavities are internal. Body cavities have several important functions. Firstly, they protect delicate organs, like for example the brain, from bumps and shock when we walk, run and jump. Secondly, cavities allow internal organs to change shape and size. For example, our lungs, stomach and bladder can all expand and contract because they sit inside cavities. And lastly, body cavities provide a warm, nurturing space for foreign creatures to implant into, grow and burst from in the Alien movies.
That's it, man. Game over, man. It's game over.
The human body consists of two main cavities, the dorsal body cavity and the ventral body cavity. If you're not sure what the terms dorsal and ventral mean, check out my other video on anatomical terminology. Let's start with the dorsal body cavity. It can be divided into two parts, the cranial cavity and the spinal cavity. The cranial cavity is the space formed by the bones of the skull. It contains the brain. The spinal cavity, which is sometimes also called the vertebral canal, is a space formed by the bones of the vertebral column. The spinal cavity contains the spinal cord. Next is the ventral body cavity. It can be subdivided into two parts, the superior thoracic cavity and the inferior abdominopelvic cavity, which is separated by a flat muscular sheet called the diaphragm. The thoracic cavity can be subdivided into the left and right pleural cavities and a central pericardial cavity. The pleural cavities contain the lungs and the pericardial cavity contains the heart. Separating these three cavities is a partition called the mediastinum. The abdominopelvic cavity can be subdivided into a superior abdominal cavity and an inferior pelvic cavity. The abdominal cavity contains the stomach, liver, spleen, kidneys, small intestine and most of the large intestine. The pelvic cavity contains the bladder and internal reproductive organs. Thanks for watching.
And speaking of inside, the body isn't just, solid tissue. It has these internal spaces, cavities, where all the organs live, often protected spaces.
Right, like dedicated compartments for different sets of organs.
Exactly. Slide 10 breaks it down. Broadly, we talk about two main sets of cavities, the dorsal cavity and the ventral cavity.
Dorsal, like a shark's dorsal fin, so on the back.
Good connection. Yes, the dorsal cavity is along the back side of the body and also includes the head. That's detailed in slide 11. And what's really significant is what's inside it.
Okay.
It contains the central nervous system, the brain, and the spinal cord. So it's divided into the cranial cavity that's inside the skull, protecting the brain, and the spinal cavity, which runs down inside the vertebrae, protecting the spinal cord.
Wow, okay. So the entire back cavity is basically hardcore protection for the command center, the nervous system.
That's the essence of it. Then you have the ventral cavity. This one's much larger, and it's located along the front of the body, as shown in slide 12. This holds the organs mostly involved in maintaining homeostasis, keeping your internal workings stable.
The day-to-day operations stuff.
Pretty much. And it's got subdivisions, too. Up top, above the diaphragm muscle, you have the thoracic cavity, the chest cavity.
Heart and lungs territory.
Yep, heart, lungs, major blood vessels. Protected by the ribs, like you said earlier. Then below the diaphragm, you've got the abdominal cavity. This is where most of your digestive organs hang out. stomach, intestines, liver, gallbladder, spleen, pancreas.
The middle section.
Right. And then the lowest part, kind of nestled down within the hip bones, is the pelvic cavity. This holds the bladder, the rectum, and the reproductive organs.
Okay, so quick recap. Dorsal is back and head, housing the crucial nervous system. Ventral is the front, top to bottom, covering chest, abdomen, pelvis, heart, lungs, digestion, reproduction, excretion. Basically everything else vital.
You nailed it.
Yeah.
And mapping things out this way starts to make sense of, why pain in one area might indicate a problem with a specific organ located there.
Yeah, it gives it structure. But you mentioned sometimes you need to get even more specific. Like just saying abdominal cavity isn't enough sometimes.
Exactly. Think about it. If you go to the doctor and just say, my stomach hurts, the abdominal cavity is huge.
Right.
Where exactly?
Good point. So how do doctors or anatomists narrow it down?
They use a grid system, basically. A way to divide the abdomen and the lower part of the chest into smaller, named regions. Slide 14 actually shows this common 9-region grid. It's standard practice for communication.
Ah, okay, I see it on slide 14. Looks like a tic-tac-toe board laid over the torso. So how did these squares get their names?
Okay, let's walk through it.
Yeah.
Think top row going from the person's right to left. You have the right hypochondriac region.
Hypo what?
Hypochondriac.
Hypo.
Hypo means below. Chondro refers to cartilage. So it's the region below the rib cartilage on the right.
Okay, under the right ribs. Got it. Then the middle top.
That's the epigastric region. Epi means upon or above. Gastric means stomach. So roughly the area above the stomach in the center.
Epigastric. Center top.
Then the left hypochondriac region, mirroring the right side. Below the left rib cartilage.
Okay, top row, done. Right, center left, hypochondrius, epigastric. What about the middle row?
Middle row, again, right to left.
Okay.
Right lumbar region. Lumbar refers to the lower back area, so it's the side region level with that.
Right flank area.
Yeah. Then the umbilical region,
Yeah.
right around the navel, the belly button,
Easy enough. Center, middle.
and the left lumbar region, the left flank.
Okay. Middle row.
Yeah.
Right lumbar, umbilical, left lumbar, bottom row.
Bottom row, right iliac region, sometimes called the right inguinal region. The ilium is the big upper part of your hip bone, so it's near there.
Lower right corner near the hip.
Exactly. Center bottom is the hypogastric region. Hypo, again, means below, gastric for stomach, so below the stomach area, often called the pubic region too.
Okay, dead center low down.
And finally, the left iliac region, mirroring the right side, lower left corner near the left hip bone.
Right iliac, hypogastric, left iliac.
Wow.
Okay.
So now, instead of vague belly pain, a clinician can say tenderness in the right iliac region. And why is that so useful?
Because specific organs tend to live in specific zones.
Bingo. Appendicitis pain, for example, classically localizes to that right iliac region. Gallbladder pain often points towards the right hypochondriac region. This grid gives you coordinates, narrowing down the possibilities dramatically. It's huge for diagnosis and clear communication.
That makes a massive difference. It really is like coordinates on the body map.
Okay, so inside these cavities, within these regions, we find the organs themselves. What's the formal definition of an organ?
Slide 15 defines it pretty well. A body organ is essentially a somewhat independent part of the body that carries out a specific function or set of functions. Think heart, lungs, liver, brain. Each has its job.
Right, and they don't just float around doing their own thing, they work together, yeah. Absolutely, that's the next level up. Related tissues and organs team up to form body systems. That's also on slide 15. These systems handle the larger, more complex functions needed for life.
And that slide lists, wow, quite a few systems. Let's see. Skeletal, muscular, cardiovascular, lymphatic, immune, respiratory, digestive, urinary, nervous, integumentary. That's skin, right?
Oh,
Special senses, endocrine, reproductive.
that's the whole crew.
Yeah.
Integumentary is indeed skin, hair, nails.
Mm.
And if you connect this back, understanding how these organs group into functional systems like the cardiovascular system for transport, respiratory for gas exchange, digestive for nutrient breakdown, that's fundamental to seeing how the entire body works as this incredibly coordinated machine.
Wow. Okay, we really covered some ground there using those slides. We started with that crucial anatomic position, the baseline, then how to slice the body descriptively with the sagittal, frontal, and transverse planes. Then we explored the major internal spaces, the dorsal and ventral cavities and what's in them, then mapping the abdomen with that 9-region grid for real precision.
Yeah. Tic-tac-toe board.
Exactly. And finally, defining organs and seeing how they form those big operational teams, the body systems.
So hopefully you listening now have a much better handle on identifying some of these key anatomical terms and regions. But, beyond just naming them, maybe seeing why they're important, their practical value, this language, it really is the foundation for understanding so much about health, injury, how your body works.
So what's the takeaway for you? It means you've just picked up some essential vocabulary. It's like getting a decoder ring for understanding your own amazing physical self and for navigating all the health information that's out there, but with way more clarity.
Yeah, and maybe consider this. Think about how this standardized language lets healthcare professionals literally anywhere in the world communicate with precision about something as complex as the human body. A surgeon in Tokyo and a radiologist in Toronto can look at the same information described using these terms and understand exactly what's being discussed. It's this silent, essential framework underpinning countless medical conversations, ensuring accuracy, ensuring understanding every single day. It's pretty powerful when you think about it.